Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 83, Why Medicare for All is Cool. In this episode, I will describe what makes single-payer Medicare for All cool. Here's the overview why Medicare for All is cool. People can get the medical care and prescription drugs they need when they need it without having to worry about cost. This medical care will include all the care you get now and add mental health care, eye care, hearing aids, dental care, and other necessary care. Now, let's get to the specifics of why Medicare for All is cool. First, there is no charge for services. When you go to the doctor, you won't need your wallet. There are no out-of-pocket costs with Medicare for All. It eliminates deductibles, co-payments, and coinsurance. You never again need to ask how much treatment will cost. Second, you can go to any doctor or hospital anywhere in the United States. That's right. Medicare for All provides more choice because you can go to any doctor or hospital. You never have to worry about whether a doctor or hospital is in or out of network. You will be in network. This means you can travel and not worry about getting sick or having an accident because the closest hospitals and doctors will be available. And to emphasize again my first point, there will be no charge for using these doctors or hospitals. Third, and even better, your wait times will stay the same or decrease. Opponents of Medicare for All attempt to scare you by saying wait times will increase, but this is not true. As one report said, peer nations with universal health coverage, quote, generally have similar or shorter wait times than patients in the United States for a variety of services, end quote. Fourth, you and your doctor get to decide your medical treatment, not some untrained insurance clerk who can deny you care. You will never need to wait for your insurance company to approve your care or worry about them denying your care. Fifth, you will not need to change doctors or hospitals because your insurance company decides to eliminate your doctors or hospitals from its network. Sixth, your healthcare is not dependent on your job. If you lose your job, you can keep your doctors and hospitals. If you change jobs, you get to keep your doctors and hospitals. This will allow you to choose the job you like, independent of the healthcare benefits, and eliminate having to stay in a job you don't like for health benefits. Another added benefit is that you will still have health coverage if you decide to start your own business. Seventh, you will not have to worry about incurring new medical debt. The current Medicare for All bills don't cancel current medical debt. I wish they did. However, Medicare for All prevents new medical debt because, as mentioned before, there is no charge for medical treatment or prescription drugs. Here's another really cool thing that Medicare for All does. I consider this the eighth wonder of Medicare for All. According to a recent survey, quote, an estimated 98 million Americans skip treatments, cut back on food, gas, or utilities to pay for health care, end quote. That will end with Medicare for All. Americans will never again have to skip treatments, cut back on food, skimp on gas or utilities to pay for health care with Medicare for All. Finally, another great thing Medicare for All will do is save 76,000 lives annually in non-pandemic years. Additionally, it is estimated that a universal healthcare system such as Medicare for All would have saved 330,000 lives during the COVID pandemic. So, to reiterate again, Medicare for All is cool because there are no out-of-pocket costs. You have your choice of doctors or hospitals anywhere in the United States. You will have shorter wait times to see a doctor. You and your doctor get to decide your medical treatment, not some untrained insurance clerk. You will not need to change doctors or hospitals because your insurance company decides to eliminate your doctors or hospitals from its network. Your healthcare is not dependent on your job. You keep your coverage if you change jobs or lose your job. You will have no new medical debt. You will never have to skip food or skimp on utilities or gas to pay for medical care. Medicare for All will save 76,000 lives per year. I would like to end with something I said at the start of this podcast. Medicare for All is cool because people can get the medical care and prescription drugs they need when they need it without having to worry about cost. That would greatly benefit individuals, families, and the nation. We need Medicare for All now. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.